Hello, everyone, and welcome to United Immigrant and Migrant Assimilation Project. Today, we have a workshop on high blood pressure management. And before we get to that, let me introduce you to the organization. The organization was formed to assist immigrants and migrants who enters this country to assist them in settling in the United States. How we do that is basically taking the miss out of the hit and miss approach. So most immigrants or migrants or returning residents, when they enter a country, they tend to be on the hit and miss approach. And sometimes they miss proper successful assimilation or proper successful settling. They end up on another path. So we're having these workshops to assist them also in managing their health. Oftentimes they have underlying conditions that prevents them from being able to do all that they can do in order to successfully settle in a new environment. So ways that you can support us, you can join us. If you're a self-starter, if you're self-motivated, you can join us. We're looking for a strong team. You can also donate to us. You can volunteer with us in other capacity, sharing your skills. And we thank you so much for joining us today. Our next event is going to be on March 19th at 8 p.m. I hope that you'll be able to join us for that session as well. So let's get into the presentation on blood pressure management. Okay, so, speaking of high blood pressure, so the workshop is on high blood pressure self-management, and it's being provided to you in collaboration, Angela and Hortense Henderson, where you presenter for this workshop. Around the world, there's 1 billion people with high blood pressure. And according to the American Heart, just in the United States, 1 in 3 has high blood pressure. How many are migrants? How many are immigrants? We're not sure, but that number usually includes everyone. Some people, they don't know, they're unaware of the condition, unaware of how to manage it when they get diagnosed, and it leads to other complications. So having this workshop is to help everyone to be the best that they can be, to live the best quality of life. So what I would like you to know and to take away from this is how to identify high blood pressure, identify some risk factors, so you don't go and blame yourself that you got it because you did something wrong. It's just life. And when we teach you the lifestyle skills that should help you to reduce your risk of developing it, controlling it, that you will take that and integrate it into your lifestyle, how you do things currently. Blood pressure didn't come overnight. It's not going to leave you overnight. And we want you to apply these knowledge to either preventing it if you don't have it or controlling it if you do have it. We will also, it's important to talk about depression because people get the diagnosis or hear that they have or their loved one has high blood pressure and they don't know enough about it. They get very depressed. And depression doesn't help the situation. They get saddened and then they get depressed. It doesn't correct the situation. It doesn't help the situation. It makes things a lot more complicated, right? So understand what we're trying to convey to you. And also when it's emergently needed for you to get help. And we have 911 in the United States. Other places may have a different number. So you need to have, you have to have something in your toolkit to say, if this happened, this is what I'm going to do. This is how I'm going to seek emergency help. And make sure you tell someone if someone's close by you. But grab that phone, get emergency help fast. So, what is high blood pressure? High blood pressure, we'll talk about later. But blood pressure in general is the force of the blood rushing against your arteries. Think of water going through a pipe. The pipe is more sturdy. The water is a force going through. It's coming at a force. There's slow force. There's russian force, and you see the power of each, right? So if anything is sticking in there during the time when the blood is rushing through, things get moved around quite a bit, and you want to decrease that also. We're going to talk about it as we go along. You'll get it. So normal blood pressure is less than 120 over 80. Before we used to say normal blood pressure was 180, was 120 over 80. So now it has been identified by the expert that the lower end of that blood pressure is the better the outcome for the future. What the readings mean, you see, there's a top number that's called the systolic number. It means when the blood rushes out of you, is pumped out of your heart and pumped through these vessels. The first vessels are bigger, and then they get smaller and smaller as they travel away from the heart. So things can get lodged in there, or it could be hard getting anything through there. It's called the arteries. So you have the heart, and it's pumping oxygenated blood, which oxygen we need for life. And we need it to get to our brain. We need to get for it to come from our lungs to our heart, to get to our brain and the rest of our bodies, right? So it's those vessels and keeping them nice and clean and flexible are important, right? So that's that top number. The bottom number is called diastolic number. It's when the heart is resting and it's collecting the blood. And it's not as slow, everything is happening fast, 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 not fast, fast, fast. If it's fast, 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 it's a different problem. It's on a rhythm like that, when how your heart beats, you say boom, and then there's a pause, boom, pause, boom, pause, boom, pause. You feel that rhythm. It's a rhythm. So it pushing and then it resting, pushing, resting, pushing, resting. And you want it to stay on that path. So if the blood pressure is high, it puts pressure on the arteries. It puts pressure on the heart. The heart can pump as best as it can. So let's go on to high blood pressure. So the pressure in the arteries becomes higher than normal. Some provider will diagnose someone with high blood pressure if they're consistently 130 over 80 or higher, or 140 over 90 or higher consistently. They want to, whatever the cause of that blood pressure going up, they want to protect the other organs. So it's not that they throw in some, I've heard people tell me, oh, the doctors only want to put you on blood pressure medicine. They don't even give you a try. They don't do it. But more than likely, they had gentle conversations with you about changing your lifestyle, doing something in order to address it. But when it's high, 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 they have to do something immediately. And that's when the pills come out. And the pills are not a magic bullet. They still need you to do something. The provider, the doctor is seeing you just for a moment in your time. They're not seeing you every day, but you know yourself every day. And there's something that you can do every day to control that blood pressure. The heart works too hard when the blood pressure is high. And that high force is going to harm those little arteries someplace else in your body. It could happen in your kidney. You don't want it to happen in your kidney, because that's how your body exchange waste. It cleans it and it gets rid of it. So you want to protect those things. So what causes high blood pressure, you may ask? Sometimes you don't know. Sometimes it's related to something else, another disease. It could be kidney disease. Remember, I mentioned kidney disease. Kidney, if you damage the arteries and there damaged parts of it, it can't help you to control your blood pressure, which is so needed. It could be medication. It could be a number of things, but those are caused. Once identified, they could be addressed. Most people that often have high blood pressure, they fit into they might fit in one or more of other categories, such as they don't exercise much. They live more of a day-to-day sedentary lifestyle. They're not active. Some people just go to work, come home, eat something, go to bed. And that's the routine for 5 to 6 days a week, nothing else. Some get home late, they eat a big hefty meal late at night, And when you look at the hefty meal, it contains nothing but carbohydrate and protein, and maybe a glimpse of vegetable, maybe, but most often, maybe a teaspoon. I say a teaspoon, could be exaggerating, but most often, when you go to a restaurant, we'll talk about that later as well. You can have a family history of high blood pressure. You can't change your family history, but you can help to control it. You can help to control aspects of it because your family usually have a certain lifestyle and you learn that lifestyle from them. You can't change your sex if you're a male. Atherosclerosis, developing the pipe, there are certain fats that are more likely to stick to the pipes. Being of African American descendant, being a smoker, being obese, not just fat, but obese, just not just overweight, but obese. And weight is not a guarantee that you don't have it, you're not going to get it. Frequent alcohol use, diabetes, kidney disease, being on oral contraceptives, female over age 55, over 55. Lots of time people are going through menopause during that time. The hormones are changing and they become more sensitive to salt. And unchecked stress, over time, it builds up. So we're going to talk about happy thoughts later. After more, more likely, you're more likely to develop high blood pressure. So if your doctor tells you about this, what are you going to do? I say the first thing you do is the doctor is going to give you the treatment that you require at this time, and it's going to talk to you about lifestyle changes, but not in detail so much. We're going to go more in detail about the lifestyle changes. So, first thing, while you're doing all of that, check your blood pressure. See how it's responding to the treatment. Get an idea. Start looking at numbers. You don't like numbers? This is just basic ones, and you have a provider who will interpret the result for you. Just keep a log of it. So, in checking your blood pressure, what do you do? Importance, we said, is to know your numbers, and you're going to talk to your provider about them. When you go to your provider's visit, bring your machine so you can make a comparison. If your reading and the provider readings don't match, guess what? It might be something wrong with the machine. And more likely, in the provider's office, they have to do a calibration regularly. So they can advise you, or you can contact the manufacturer about how to calibrate yours. So you'll be on the same path as your provider. So what they're seeing is what you're seeing. And when you come with your record, it's more comparable. Ways that you should measure your blood pressure. When you get up in the morning, your blood pressure is starting to rise. And then by midday, it gets to the peak of it and then it starts to go down. So it's on a rhythm. It's on a rhythm. Everything is musical rhythm, right? Your heart is on a rhythm, your blood pressure rhythm is on a rhythm. So it's important for you to measure them, accurately. So select the correct cuff. If you don't have the right cuff size, if you have a bigger cuff size, the cuff size is based on the measurement of your arm. Inside of every cuff, they usually have measurement in centimeters, and for some of my Caribbean people, centimeters. So the measurement is inside the cuff. If it's your arm is too small for it, you're going to get the wrong reading. You're going to get a reading, but it's not going to be the right reading. The smaller the cuff, the higher the pressure. The larger the cuff, the lower the pressure. And if you do something other than that, you're tricking yourself and you're causing yourself, unwanted stress, or you can cause your inappropriate treatment as well. Sit with your arm, not low nor high, but at the level of your heart or your chest. Avoid speaking while you're having your blood pressure taken. A lot of us have a lot to say when we get to the doctor, but we should, close it just for that time. If you're very cold, don't start measuring, wait until you're warm. And that's why when you go to your provider's office and sit in the waiting room for a little while, it's okay. You didn't rush into the room. And waiting 15 minutes is also golden, because sometimes you have just finished exercise and then you run into the doctor's office. You have just finished eating or having something hot. Wait a few minutes, If you have a full bladder, it's a great time to empty your bladder. Avoid tight clothing Anything tight around the area. It could be your arm. It could people without arms, they have legs. So if around your thigh, you need to loosen it or just remove it. The bare skin is the best skin. So if you're upset, check the mind. Just think happy thoughts. Wherever your happy place is, go there at that time. Sometimes you get news from your provider and you're stressed out. That is going to affect your blood pressure. So you want to mind your mind. Some of the tools that in self-management that we want to empower you with is that lifestyle modification. Your provider might have told you control your salt, lower your salt, eat more fresh fruits and vegetables. And you go, basically, what's that? Why do I need that? But I'll tell you why. There's a diet that says dietary modification. It's called the DASH diet, and it's a diet to stop high blood pressure. You see how important blood pressure is, stopping high blood pressure is? That there's an entire diet geared to it. And what it is exactly what the provider told you. More fruits and vegetables and decrease the starches. Eat a variety of the spice of life. Exercise, we're going to go into exercise, stress management, and about taking your medication because these are the tools that you need to control your blood pressure. Sometimes dietary exercise and stress management is enough. Sometimes you need that medication added. Let's look at stress management. How do you manage your stress? Get your stress under control. Take time out of every day to relax. Sometimes you're pissed off. Do some deep breathing exercise. Relaxation. Some people do yoga. Yoga might cost money, but guess what? Sitting out in the park or outside under a tree and just close your eyes, take in deep breath and hold it for 10 seconds. Like, watch me. So you take in a deep breath and you feel your chest fills up and you count to 10 or you can count to 5 and let it out through the kiss lips. It's pierced lip, but you purse lip, but you pucker your lip and blow it out. Okay? And slowly blow it out. It's a way of relaxing. Mind your mind, think happy thoughts. Manage sadness because sadness can lead to depression. Spend time with people who makes you happy. The ones that don't make you happy is going to drain all the energy that you didn't have. They're going to tax your energy. So avoid them, especially when you're going through some states of sadness or depression. Maybe the place that you feel happy is going to church, speaking to your pastor, speaking to your church members, seeing a counselor on a one-on-one where your thoughts are private, having a good companion, and don't tell strangers things that you don't want to be repeated or your friends. So you have to know who's a part of your team. Just don't hang out with unhappy people or people that makes you feel unhappy because they're going to suck the life out of you. So next, we go on to nutrition. Nutrition, we went at stress management, nutrition, they're key, they're golden part of your management of blood pressure. So DASH diet, it's a variety of a spice of life. Eat a variety of food, mostly plant-based, You do get some fibers from plants, but not as much as the rest of of the main carbs. Eat in proportion. If you have a 9-inch plate, just cut it in half of it vegetable, quarter of it, think about that imaginary line, straight down vegetable. A quarter of the other half is protein. Quarter of that side is starch. Add your starch. If you don't know what starches are, in our diabetes session in April, we'll go over that. In the meantime, look on Google. Google has a list of starches and no one gets that one wrong. The next group is saturated fat, decrease the saturated fat. Your provider, when you go to the doctor, they also measure your cholesterol level. They give you a total cholesterol level. They give you the good cholesterol because your body needs cholesterol in order to function. They tell you about the bad cholesterol, that lousy cholesterol. It's low, low, low. So those are more likely to cause you heart disease. They're not the healthy fats. So when you go to your provider, make sure you know what that number is, what your lousy cholesterol number is, and you want to work on fixing that. It will be magical and wonderful if you're able to see the changes in your lifestyle that it's doing towards controlling that. So saturated fats is more likely to stick to your arteries and make it harder for blood to rush to flow through there. The harder it makes it, the more difficult it is. And the more difficult it will be to manage your high blood pressure. Let's look at sodium to portion size. So here's this label, the label reading. First thing we're looking at the amount of sodium, and it's 160 milligram, which is less than 1 teaspoon of sodium. The serving size in 2/3 of a cup is 160 milligram. If you go beyond 2/3 of a cup, you have to multiply that. So if you take 2 servings, because 1/3 is 2/3 of a cup, not a full cup. So if you take 2 servings, you have to multiply that by 2. So that gives you 320 milligram. Sometimes we see containers and we just look at the size and say, that's enough for me. But read the label about serving size, because you could be consuming more than you expected. Sometimes, if you misread the label, you'll just look at the sodium and say it's 160, but not looking at the serving size. And it's key. Serving size is key for you to understand. So I gave you a sample of a label, and I hope it's able to help you and guide your choices when selecting foods. So look at these salts, different kind of salts. How do you get a teaspoon? How do you get a teaspoon out of them? Most of them are rocks. So that means when you get a teaspoon, it's less sodium that's on that teaspoon, as opposed in comparison to the table salt, because the table salt, the crystals are much finer, whereas the rock salts are much bigger. So not much rock can fit on a teaspoon. Then we go into exercising. And the basic exercises, right? Basic exercises are moderate exercise. It's brisk walking. Whatever you do, get moving. If you don't have any legs, throw your hands up and shake to music. Just throw your hands up, move your head and your neck. A little stretching exercises does help. If you have legs, go walking 30 minutes a day, 3 times a week. Do it. You can do 3 10-minutes a day, but don't do the usual stroll. Do brisk walking. Walk. And in terms of the walking, get a partner. Look at these ladies. They're smiling. Why? More than likely they're receiving endorphin, and endorphin makes people happy. And they're walking with good company. So let's move on to sadness, what sadness is and the consequences of sadness. Okay, what does sadness look like? People might have persistent anxiety, they have an irritable feeling, they can't sleep, they're fatigued, they have pains coming from all over the place, and there's no specific reason for it. And they might be entertaining dark thoughts. Sometimes they get out of it, sometimes not. And it's important to control the sadness, because it can lead to depression. You don't want that. And so you say, what is depression? And the typical images of what depression is and what is sadness. So some of the signs that you could look for it's changes in eating habit. They might be eating too much, too little. They might have weight gain or weight loss. They might be sleeping too much or too little. Some people can't get out of bed. Some people consider that lazy or something else. They might be feeling hopeless, helpless, lack of interest in anything or the usual things. They may also feel that they could be better off dead than alive. People getting diagnosis of chronic diseases can go through these symptoms. Initially, they are saddened. Many are saddened with the diagnosis, and it has led to depression in many as well. So it's important when you have a loved one or even yourself to be aware. If you're aware, you can have a plan in how to address this. And these videos are not the end all. It's important that you talk to your provider. This is increasing your awareness, increasing your sensitivity. So if you or someone you know is going through this, there's help out there. And at the end of this presentation, we will have phone numbers that you can call from wherever you are to get some advice, because the life you save may be your own. Then we go into smoking. Smoking is another risk factors that we spoke about in the management of high blood pressure. It didn't just happen, so you can't just stop it, but you're going to need a lot of support in stopping it. For some people, need more than others. So if you can't stop, decrease it. You didn't just start it, so decrease until you can stop it. Have a goal. Have between that within a certain time you'll be able to quit it. If you need support, talk to your provider. If your provider doesn't have the answer, Google your nearest health department. They will help you to quit, because this is important. They have all kinds of assistance available to you. But go to Google. They have smoking cessation websites, and they can advise you. That's it on smoking. Then we go to medication, because that's a part of management, right? So many people get prescribed by unlicensed professionals. They either prescribe by unlicensed professional or they self-prescribe. But it's whatever source it comes from, tell your provider so they can help you. So they can help you to navigate this process, to see what medication could be interacting with whatever supplement you're taking or whatever other treatment you're doing. So work together. You're the key to this team. You're the key. When I say you're the key, you know everything. You're the greatest scientist. However, you have to get all your partners involved. So let your provider be aware of what you're taking and what you've tried before, because I know my people from the Caribbean, we have tried and we're going to try something before we go to the doctor. The doctor is the last resort. So whatever you're taking, have a conversation with the doctor so the doctor will know that you've tried this and you've tried that and it didn't work. Because you don't want your kidneys to go bad, because next thing you know, you're going to end up on dialysis. And dialysis, organs doesn't sell in the store easily. And if it sells in the store, if you might have trouble, being able to afford it. So have your provider as your team. If you take the time to go and engage a provider, take the time to supply the right information. Don't worry about upsetting the provider. They need to know, because that's how they can help you to protect yourself. You'll make it easier for them. And I recommend that people go to their provider at least once a year to get a checkup, get an idea what your blood levels are looking like, because your sodium level, it could tell that your sodium level is a little bit elevated, or it could tell that your kidney is being affected. But the sooner you know, the more likely it is that you can get timely assistance. Cough medicine and ibuprofen, for example, we self-prescribe those all the time. People with high blood pressure should not be using those routinely, because it will increase your blood pressure. Then we go to medications prescribed by the licensed professionals. In this one, we recommend avoiding multiple pharmacies. The reason why we say avoid multiple pharmacies, because if you use different pharmacy, the other one won't know what was prescribed to you. So if the eye doctor prescribed something and the medical doctor prescribed something and the dentist prescribed something and your nephrologist, kidney doctor prescribes something, your heart doctor prescribes something different. So you want to keep everybody in the same place, because some medications, all medications has 2 or 3 or 4 different names. If you're not familiar with all of them, somebody might be, each one might be prescribing the same thing for you. And next thing you know, you have a drug overdose. You have too much of the same medicine. And that can also harm you, harm your liver, harm your kidney, harm your heart, and many other places. So you want to make sure you're taking the right medicine, even the right herbs for the right thing to get the right outcome. Do not leave the pharmacy without comparing what your provider prescribed for you, because they usually give you a list, what they prescribed for you and when the pharmacy is given to you. If the pharmacy says there's a problem, contact the provider's office and say there's a problem with this medication, because the next visit that you're scheduled to see the provider is looking for a result, and the result could be based on that. Don't waste your time going to see the provider without having everything taken care of that you were supposed to do. That's why you got homework. Your medicine is your homework. Picking up your medicine at the pharmacy is part of your homework, and taking it is part of the homework to see the outcome. So comparing, also find out the side effect. If you don't know the side effect, go to drugs.com and put in that medicine in there. It will tell you what the side effects are. You might not experience all those side effects, and it doesn't happen to everyone. So you want to see what's happening to you and the explanation for it. Talk to your provider. Talk to your provider once it starts. Some medicine, you cannot abruptly or quickly stop it just like that, because in your body in turn has a rebound. It's called rebound high blood pressure. So it quickly increase your blood pressure after you abruptly stop that medication. The providers that you work with, they will either wean you off or safely switch you. So one size doesn't fit all. And we'll talk more about the one size doesn't fit all, because especially male, their number one reason for stopping medication that I've always heard is something related to their sex life and erectile dysfunction. So work with your provider, avoid stopping your medication abruptly. And with medication comes side effects. We spoke about some side effects. The side effects, you talk to your pharmacist. Go to drugs.com if you have a smart device. Talk to your provider about the side effects that you're experiencing. Know the side effects before leaving the pharmacy. Talk to your provider if you experience them. There are many side effects with taking medication to manage high blood pressure. But this one I would like to focus on is the orthostatic changes, which is the sudden drop in blood pressure when changing from sitting to standing or from lying to sitting. So I want to stress this one. People fall, especially the elderly. And that's why this is a very important aspect of the side effects that you should focus on. Change position slowly. Do not get up and start walking right away. Whether you're getting up off your bed, getting up off the toilet, getting up off of a chair, change position slowly, meaning slowly stand up, give your body time to adjust. If you're feeling dizzy or oozy, sit back down and wait until that feeling goes, and then try again. For most people, the blood pressure needs to be less than 140/90. Remember, we spoke about if the blood pressure is 130/80 or greater, and for people with kidney disease and diabetes, their blood pressure needs to be a little bit lower because you're trying to protect the kidneys too. So theirs should be less than 130/85, according to the American Heart Association. Achieving these blood pressure reduces the risk of having bad outcome. Bad outcome, heart attack, stroke, kidney failure, or blindness. And achieving it is possible. So, what signs do you see when your blood pressure is high? What are the signs that you see? If you're looking for a sign, you're doing that Russian roulette. You're playing in traffic on a busy highway. The traffics are just darting by. You don't know which one is going to hit you. So it's a dangerous chance that you're taking with your life, waiting for a sign for blood pressure to warn you, for high blood pressure to warn you. If you start having a sign, it might be too late. Some people says, oh, when my blood pressure is high, I get a nosebleed or headache. Go and get it taken care of. It might be too late. It's usually not an early sign that your blood pressure is elevated. And that's why high blood pressure is considered a silent killer, because it gives you no signal. Sometimes you go to the eye doctor. If you go to your medical doctor and you screen regularly, yes, you will be able to, they will tell you come back in a short period of time. And in that short period of time, like 3 months, they will be able to diagnose you timely. Other times, the eye doctor is seeing when you go to your eye doctor, they're seeing the back of your eyes, the condition of the vessels, because remember we talked about tiny arteries that the blood has to flow through. The eye doctors will see that and be able to detect that early, because it can lead to blurred vision and blurred vision to blindness. And I know you need your eyes to see in order to function. If your blood pressure goes uncontrolled, as we said before, guess what happens? You have heart attack, stroke, kidney failure, requiring dialysis, or blindness. And how easy are these to correct? Preventing them is better than curing them. So if they're not controlled, you're going to have some late signs. And some late signs are, if it could be blood pressure of 180/120 or higher. If that happens, if you're home and you check in, if that happens, recheck it in 5 minutes. If it's still the same one, call 911. Don't take any chance of taking public transportation, delaying going to the hospital, or activate your emergency system, because you could be watching from anywhere. And if your blood pressure is usually high and now you're having headache, nosebleed, feeling and not feeling well, it's time to go. It's time to get help. Other times, if you're having chest pain, jaw pain, pain moving down your arm, get 911. Get your emergency system to get you help. Stroke, sudden numbness, or weakness in the face, arm, or leg, especially on one side of the body. Confusion, trouble speaking, or difficulty understanding the speech of someone else. Or if you're with someone and these are happening, get them help right away. Call 911. Do not navigate the traffic to get anywhere. Call 911 to get to you if you're in the United States, because it's usually faster. If you're living someplace else, know where your emergency system. Get to your emergency system. You might have trouble seeing in one eye or both eye. You might be falling. You might be walking and then and then falling because you're having trouble walking. You might have dizziness, loss of balance, or trouble coordinating your efforts. Sudden headache, it's like somebody hits you in the head without hitting you. And for no reason, call 911 or get your emergency system activated. So these are things that try to prevent them, because when they happen, you can have residual effects from a stroke. You can die from it. You can die from a heart attack. Some people live, some people die, but you don't want to not do anything or not having a plan. We all say not us, but having high blood pressure and having it uncontrolled increases the risk of having it. So the next thing we spoke about a reason that men will stop taking blood pressure medicine. Some people stop it because they're having a cough in terms of side effects. Sometimes that medication could be decreased or changed to something else. So it's important to talk to your provider in the medication management, because there's some medication that those side effects are associated with. And so are having rectal dysfunction. But in general, it might also happen just because the blood pressure is uncontrolled, not because of the medicine. So if no medicine is on board that's triggering that, it might be related to the blood flow. The blood flow cannot get to that organ because of the conditions of the artery. It's too narrow, the force is too much, and there's plaque developing in there. So lifestyle modification, I have to say over and over, you have to include it in the management of your blood pressure. It doesn't take away, your responsibility to do what you can. The doctor sees you for about 30 minutes and you have to live with yourself the rest of the time. So please manage your high blood pressure. So all that I've said, I want to get your feedback. Let me know what you're thinking if you have any question. So, you know, we're here for you, and let's work together. I would like to, hear some of your plans, some of your challenges in managing your high blood pressure. You can follow us on Facebook at UIMA Project on Facebook, or you can email us at uimaproject@gmail.com. Again, it's UIMA Project@gmail.com. So let us know what you're thinking, what your thoughts are, and let's stay in touch. Our next event will be on March 19th, and we have the diabetes one on April 9th. And it will be also done by myself and Hortense Henderson. So some resources for you is the American Heart Association. Will tell you more about blood pressure management, and they always have up-to-date information because the information is researched and refereed. So not just one person giving you their expertise, but in combine, it's a solution to some of your issue. If you're feeling depressed and suicidal, or saddened and suicidal, this is a number that you can call, National Suicide Prevention Hotline. Then you have LifeNet, 1-800-LifeNet Network, to talk to someone if you have trouble, feeling depressed, have trouble coping, so they can help you or refer you to resources. Some examples of exercises also, I saw a great YouTube video with just moderate walking. So this will give you an idea. You might find something else that's better for you. So let me know. And let's share, let you know more about our organization, United Immigrant and Migrant. So we thank you for viewing, and we want your support. Let us know what you're thinking. You can donate to us. You can join us as a volunteer or share your skills with us. And again, our email address is uimaproject@gmail.com. And you can WhatsApp us as well from wherever you are. And we also have a website that you can be updated with information on. And we will store these videos on YouTube. So if you're watching from there, so everyone have access to them. Please let us know what you're thinking. And we are looking for members that believes in the mission of assisting immigrants in resettling into their new country. We take the miss out of the hit and miss approach. We take the miss out of the hit and miss approach to resettling in a new country for newcomers, new immigrant entering the United States or returning residents. And we're looking for partnership, collaboration, and teamwork in order for our mission to succeed. We need you. Thank you and have a great one.